Joining us now via Skype from Los Angeles, we have got Dr. Jeffrey Klausner. He is a professor at the UCLA School of Medicine. He also spent more than a decade at the San Francisco Department of Public Health. And Dr. Klausner, we spoke to you March 7th, a couple of weeks ago, and what a different world we were living in then.
Yes, hi, good morning. Things are much different. Panic has greatly increased.
So, when we talked a couple of weeks ago, we talked about, our level of worry, and at the time you thought, okay, well, maybe we're close to the peak. What has changed for you and what you're seeing that has told us, that the peak may be a ways off now?
Well, I mean, we still see what, we see with our eyes. In every single country where there's been an outbreak, it's gone up and it's gone down. There's certain conditions required for an outbreak to take hold, such as physical closeness, certain personal behavior, certain temperature and humidity conditions. We've not seen any generalized spread in the Bay Area. We've not seen any generalized spread in California. But what we have is seen a generalized spread in panic.
So I guess from your point of view, are we doing enough? Do we need to do more? Are we doing too much? I mean, do we need a nationwide shelter in place? I mean, we don't want to go the way of Italy with how many cases and how many fatalities they are seeing there.
Yeah, absolutely not. I mean, we need to tackle this based on the local epidemiology, with local measures based on the number of cases and where those cases are. We need to use our testing resources strategically. Health departments need to invest in testing. Commercial labs have testing available. There's new pop-up labs occurring around the country, and really have to move away from this sledgehammer approach to a strategic approach based on where cases are and where we need to do interventions, like in nursing homes, protect the vulnerable, isolate cases, but there's no indication absolutely for this nation or statewide shutdown.
So you think this is too much right now?
Completely too much right now. We have the ability to control the epidemic as they have in Taiwan, in Singapore, in Japan, where there were no national shutdowns. And remember, all these epidemics have been highly localized to one city or one area. There's been no generalized spread. Even in Italy, it's all in the north. There's very few cases in Rome, in Naples, in other major areas. People really need to rethink what we're doing and take a critical look at the epidemiology.
To be fair, when we talk about places like Singapore, they were really able to track down who had it and really get the people who were infected into, a quarantine very quickly. I mean, I think that ship has sailed in terms of what we're talking about here. So why do you think that what you're saying is in direct conflict with what the governor is hearing from medical professionals, or what Dr. Fauci is saying in terms of sheltering in place, and why you don't have that same approach as we've been hearing from other medical professionals?
Right. Well, there's been actually other medical epidemiologists, John Ioannidis from Stanford and David Katz from Yale, who have raised this issue, is that we can pivot, we can take a different approach. We don't need to shut down the economy. We can get people back to work and back to schools if we take a localized approach based on the local epidemiology of infection. So look at the Bay Area. There's about 550 reported cases in a population of 7 to 8 million people. That's actually a very low reported case to population rate. When new cases occur, they can be isolated, we can do contact tracing, we can put in place tried and true public health interventions without doing a shutdown. I think the governor's office really needs to reconsider its approach. It needs to have a time-limited order that expires in 5 days, and it needs to reassess what we're doing.
Let me ask you this. I mean, obviously we know that a shutdown and these shelter-in places have a huge impact on the economy. They have a huge impact on people's wallets. And so certainly that is, for people who want to go back to work and who are scared about how they're going to pay their bills, and that's why the Senate is working right now to get money to people, because that obviously, a recession is a big concern. But from strictly a health perspective, if the shelter is in place in terms of spread, is there any downside with just being extra careful so we don't overwhelm our health systems?
Yeah, I find that to be a fallacious argument that, in an abundance of caution, we need to turn America's engine off. I think that is complete overreaction. I think we can do interventions based on the local epidemiology. There's been a rapid number of cases in New York City, so further social distancing and stay-at-home order in New York City might make sense at this time, but it does not make sense in the entire state of New York or in the entire country. We need to reverse what we're doing and think about things locally.
Okay, and so given what we're doing, let's say, this continues to go on. Let's say that what you want to happen does not happen and the shelter-in-place stays, and maybe even expands to other states, because we certainly have seen other states going the opposite way and putting those in place in places like Connecticut and other states. Where are we in terms, as you're looking at coronavirus and COVID-19 and how it's going to react, that we will see this peak that, I talked to a mom in Italy who is in Rome, who's like, every night at the dinner table, my kids sit down and say, have we hit the peak? And I think that's going to be a conversation at dinner tables, here in the United States. People say, are we almost done with getting, with this pandemic? And I think a lot of people feel like it's so far off. How far do you think, in an epidemiological perspective, that the peak could be far out, or where it is?
Right, well, we saw the epidemic peak in Wuhan, China in about 16 to 19 days, so about 3 weeks. So when the cases start to increase, when they start to double in those first few days, it looks like it's about 3 weeks before we hit a peak. But every epidemic has gone up, every epidemic has gone down. Many have never taken off. We have not seen epidemic rates in Santa Clara, in San Francisco, in Alameda. We actually have a low number of cases. Yes, there are continued new cases, and there will be clusters of cases in families, in nursing homes, perhaps in businesses where people have been in close contact, but there's no generalized transmission. So my recommendation is to be thoughtful, to rethink what we're doing, continually assess, and have a localized approach.
Do you think by summer we could have some semblance of the life we used to know?
I think by mid to the end of April, we're going to be changing what we're doing, if not even sooner than that. There's favorable conditions in terms of weather and humidity. If you look at the actual weather humidity belt of where the outbreaks have occurred in Wuhan, in Korea, in Iran, in Italy, they're all in this narrow band of cool temperatures in the 40s and moderate humidity like they have in New York right now. So it's unlikely that we're going to see continuation of these outbreaks as the weather continues to warm and becomes drier in some areas and hot, or more humid in some areas as it gets more rainy.
Well, I certainly hope you're right. At UCLA, what kind of work is being done right now to really study COVID-19?
Right, so there's a lot of epidemiological work, so people are tracking carefully the numbers of cases, the distribution of cases by age, by sex, by physical geography. There's also exciting new clinical trials going on in terms of new antiviral agents, but probably the most activity is on preparedness. So there's a huge amount of training going on, and development and implementation and monitoring of protocols. And then there's also a scale of testing. So there's increased testing that's available through the health system, and there's also studies that are ongoing, looking at novel treatments.
How do you feel about chloroquine and these malaria treatments that the president has talked about in terms of treating COVID-19, at least the symptoms, before we get a vaccine?
Well, I think we definitely need to wait for the clinical data. So we recently reviewed a report looking at chloroquine and azithromycin, and there are a lot of concerns about how that study was actually analyzed, and one cannot draw any conclusions from that study. And while medications work in the test tube, we really need to test them in humans to see if they have any true efficacy. Yeah. But there are other antivirals that I'm optimistic about, that are in clinical trials, that have shown in case reports and case series to be potentially effective.
All right, Dr. Jeffrey Klausner, we appreciate your insight. I certainly hope that you are right, that April will bring some normalcy, because we would certainly all welcome that with open arms. Thanks so much for your time.
All right, thank you.
All right, time now is 8:40.